Hello, I'm Matthew Weinstock with Hospitals and Health Networks. Population health management. It's perhaps the biggest buzz phrase making its way through healthcare these days. But what exactly does it mean, and how are hospital leaders positioning their organizations to take a more comprehensive and risk-based approach to patient care? That's the theme of the October issue of H&HN. Starting things off, our cover story, which examines how some entrepreneurs are capturing market share by taking on a risk-based contracting approach. As the story suggests, hospital leaders really need to take notice. Here's Managing Editor Bill Santamore with a closer look.
The October cover piece is part of our year-long series on new and emerging models of care delivery. In this installment, called Embracing Risk, contributing writer Howard Larkin looks at how hospitals and health systems are assuming more financial risk for communities of patients through concepts like accountable care and population health management. Howard interviewed dozens of hospital and health system leaders across the country, some of whom are plunging headlong into risk and population health management, and some of whom are moving at a more gradual pace. There are valuable lessons to be learned from all of them. I think the biggest takeaway may be that all the hospital leaders interviewed agree that organizations need to move forward into these areas at whatever pace they're comfortable with, or otherwise they'll be too far behind the curve when value-based payment becomes the norm. The consensus is that doing nothing is the biggest risk of all.
Thanks, Bill. Continuing with that population health theme, our interview this month is with the head of Dignity Health's Community Health Program. That system crunches zip code data to identify unmet needs of various patient populations and then uses that information to develop an action plan. Also this month, staff writer Marty Stepniak put together a special fold-out section that describes some of the foundational steps hospitals should take in building a population health management program. It's an excellent tutorial. Shifting gears just slightly, senior writer Paul Barr continues his series on the boomer generation. In this installment, he looks at how the surge of retirements could really impact staff models. Here's Paul with more insight.
One of the biggest of the boomer challenges facing healthcare is the looming retirement of thousands of baby boom generation caregivers, administrators, and staffers. So not only are millions of baby boomers expected to enter healthcare more frequently as they age, but large numbers of the people who would be taking care of them will be retiring. The outlook varies for nurses, doctors, and administrators. The nursing shortage may be tempered by a ramp-up in college enrollment. The doctor shortage is expected to continue. Some believe that the management ranks are in a good position to adjust, given the changes taking place in how care is being provided. Healthcare reform also may play a role in easing the shortage for other types of workers by making things operate more efficiently.
Thanks, Paul. And on one last note, October marks the final column for executive editor Mary Grayson. After more than 30 years with the publication, Mary's retiring next month. Her steady hand has helped guide us through some major changes, and we wish Mary well in the next chapter of her life. So please take some time to read the Health Matters column where we pay tribute to Mary after we comb through scores of her columns. Many of her insights are as true today as they were 10 or 15 years ago. I'm Matthew Weinstock. Thanks for tuning in.